All right, this will be an interesting health care reform debate because a new state proposal in Arizona aiming to protect voters against those penalties and requirements in the proposed health care reform bill, well, it's backed by Republican Steve Forbes and Congressman John Shadegg, but Democrats say this is just another state-driven effort to block the government overhaul of health care. We're joined by Republican Congressman John Shadegg of Arizona and Democratic Congressman Anthony Weiner of New York. Good morning to both of you, gentlemen.
Good morning.
Glad to be with you.
All right, so Congressman Shadegg, you and Steve Forbes have come up with this idea. You basically want to amend the Arizona Constitution in which way?
Well, this is actually done by the state legislature. Steve Forbes and I are embracing it. What it simply says is that in matters of state concern, the state should control. And there's nothing in the U.S. Constitution about health care. Therefore, this is a matter of state concern, and the courts have ruled that state law can dominate. The things that this initiative says, and it will go on the ballot and amend the Arizona Constitution, are that people should be entitled to buy any health care plan they want that's legal, and second, they should not be compelled to buy any health care plan they do not want to buy. The federal law mandates that you buy a federally approved plan, and the people of Arizona, in a matter of state concern, health care, want to be able to say, well, we'll buy a plan and we'll help fund health care reform nationally, but we don't want to be told what plan we have to buy.
Congressman Weiner, wouldn't this upend the whole health care reform? Because it's not just Arizona. It's my understanding that about a dozen states are going to put this on the ballot.
It's actually 22 states.
22 states.
22 states.
No, it wouldn't at all, because the residents of Arizona and the other states are going to have to say, do we want the additional choice and competition that comes from the National Health Care Plan? Do we want the additional protections that come from this law? Do we want the additional federal dollars that come to Medicaid? I think they're going to reject it. Look, I have no problem having this debate in 22 or 51 or 75 states if we add any. The fact of the matter is that people support national health care, and people want the idea that they want lower costs, they want more competition and more choice. I'll come to Arizona and I'll have this debate with anyone that wants to have it. If the people of Arizona want to reject the federal assistance that comes and the additional tax dollars and the additional protections, let them do it. They're going to find, as they put this on the ballot, they're going to lose. People like the idea of having more choice, more competition, and lower costs.
Yeah, but Congressman Weiner,
Really?
I think what Congressman Shadegg is saying is that the personal freedom, at least he believes, of his constituents is being taken away by this health care reform plan.
Well, yeah, but he wants to put it on the ballot and let his citizens decide. I'm okay with that.
No,
if they want to keep having, hold on a second. If they want to keep having the debate about whether their citizens want to have more choice in health care and lower costs, I say bring it on.
Anthony.
I have no problem. Let me just finish my thought. I have no problem with having that debate. If it wants to be on the ballot, let's have that debate in Arizona. They're losing it. They're losing it nationally. They'll lose it in their home states.
Congressman Shadegg, should Congressman Weiner be nervous after watching the town hall meetings?
I'd love to be able to get into this debate, except that I'm not being allowed to.
Well, you're in right now. Should Congressman Weiner be nervous because of the town hall meetings that we saw in the summertime?
Let me explain why he should be nervous. Number one, only 32% of Americans support the federal plan. Health care reform, all of us support. This bill, 32% support. Number two, every authority says it will not bring down cost. Number three, it clearly will not increase choice because you're going to have to choose a plan approved by the federal government. Right now, you can choose a plan approved by 50 different state governments. There is no way that this bill will either control costs, nobody says it does, improve quality, or improve choice and give people more choices. That's why the people of Arizona don't want to be told by the United States Congress what they can and cannot buy, what they have to pay and don't have to pay. And that's why they're saying, look, any matter of health care, and I haven't heard Anthony say there's anything in the U.S. Constitution that gives the federal government the authority to regulate health care. The people of Arizona are saying that's a matter of state concern.
It's certainly fine.
So we want to be able to control it at the state level.
Right, and this could end up at the U.S. Supreme Court. Congressman Weiner, unfortunately I'm out of time, but it could end up at the Supreme Court, and we will have to rest assured see what happens in these states when it appears on the ballot. To both of you, thank you so much for your time.
Thank you.